Let's talk about myelodysplastic syndromes. In myelo stem cells, dysplastic, there's some problem, dysplastic problem, syndrome, couple of features. So stem cell disorders involving ineffective hematopoiesis. In stem cells, you have ineffective hematopoiesis, which leads to defect in cell maturation of non-lymphoid lineage. So defect in cell maturation of non-lymphoid lineage. Bone marrow blasts less than 20%. Blasts are less than 20% in versus greater than 20% in AML, caused by de novo mutation or environmental exposure. For example, radiation, for example, benzene, for example, chemotherapy. Risk of transformation to AML. So this less than 20% can increase. You can get greater than 20%. There is a risk to going to AML, more common in older adults. So what is this? So basically, this is an asymptomatic in which you have a pancytopenia and despite hypercellular bone marrow. So you have a pancytopenia despite hypercellular, but although less than 20%, bone marrow. You have the asymptomatic condition when you have pancytopenia, in which you have hypercellular bone marrow, but less than 20% of hypercellularity. And this is a leukemic disorder. How is it a pre? Because we know it can go into AML. It's a pre-leukemic disorder. Okay. And now let's talk about pseudo Pelger-Hewitt anomaly. This is basically neutrophils with bilobed duet nuclei. Looking at the picture here, bilobed nuclei, duet mean Hewitt. That's what they are trying to tell you. But associated with myelodysplastic syndromes. It is associated with myelodysplastic syndromes or drugs like immunosuppressants. Okay, that's pretty much all we have for myelodysplastic syndromes, MDS.